welcome all and good morning, especially to our Committee for Ballarat members, to our participants of LBWR 20, to our LBWR alumni, and to all other guests who are online with us this morning. My name is Michael Poulton. I'm the CEO for Committee for Ballarat, and I welcome you to our third in our Leadership Learnings webinar series. And today we're hearing a local story, and it's a local story of innovation, of enterprise, of collaboration, and hopefully of great success. But more on that shortly. I'd like to start by acknowledging that today we meet on the traditional lands of the Wathaurong people. I thank them for their custodian of this country and recognise the contributions of all Aboriginal and Torres Strait Islander people throughout our community. I pay my respects to our Indigenous elders, past, present and emerging, and to all Indigenous people who might be joining us today. I'd also like to acknowledge all the parents who are online at this stage, who are juggling working from home with homeschooling. I know it's a difficult time for families. We will get through this together, and just to let you know that Committee for Ballarat and the community are really thinking of all those people who are juggling those demands at this difficult time. Today we bring together our local federal Member for Parliament, Catherine King, and Gekko Systems Director, Elizabeth Lewis-Gray. Catherine was elected as a member for Ballarat in 2011 and has been re-elected in each of the 6 federal elections since that time. Catherine, that seems like a very long time ago, many elections. As part of Julia Gillard's government, Catherine was the Parliamentary Secretary for portfolios including health, and among her many responsibilities was oversight of the Therapeutic Goods Association, and that'll come up, I'm sure, in our conversation today. Catherine's held a number of parliamentary roles, including the Shadow Minister for Health from 2013 to 2019. She's currently the Shadow Minister for Infrastructure, Transport and, importantly, Regional Development. And it's with the Regional Development hat on today that we're really looking forward to Catherine's contributions. Elizabeth Lewis-Gray is the co-founder and director of Gekko Systems and, more recently, Gekko Medical. Gekko is a company dedicated to driving change, and at the forefront of that change has been the partnership of Elizabeth and her husband, Sandy Gray. When COVID-19 hit, Elizabeth and Sandy set about their minds to the solutions, and the story that Elizabeth will share today is one of genuine innovation, enterprise and collaboration. The conversation will also focus on the broader question of what potential Ballarat has to become a national and potentially a global centre for research and development, manufacture of medical technology. Catherine and Elizabeth will guide us through this, and we've also invited Dr. Mark Yates, Executive Director of Birch, whose vision is to position Ballarat at the forefront of translating world-class research with world-class healthcare practice. And we'll call on Mark a little later in our conversation. But for now, it's welcome to Elizabeth and Catherine. 6 federal elections, time has really flown by. How have you coped for that length of time?
It feels just like yesterday, always. It's, I think the beauty of, as you see from what we're about to hear from Elizabeth today, there's always something new, something happening that, sparks your energy and interest always. So, I've been very, very privileged to represent the city and the wider region for that length of time, but always something new to learn.
And there's nothing more new than what we're currently going through right now. Can you give us a bit of a snapshot of what the life looks like of a federal politician right now who probably can't travel quite as much as she was used to? Maybe, thank goodness.
Well, I think the first thing is that the sheer volume of work that we're dealing with. I think literally the day, when we first started to have shutdowns, my office has been incredibly busy. We're having hundreds and hundreds of calls and interactions, whether it's from businesses trying to work out, what the rules are and how they can pay their staff, right the way through to people who are stuck overseas and trying to return home, or people who've got parents overseas who are dying. We've been incredibly busy. So there's been that. Obviously, from the portfolio's point of view, transport and logistics has been pretty critical. The fact that our transport industry has been able to keep food and delivered around the country. We haven't had huge problems in terms of outbreaks in logistics. We've had a few in some of the warehouses, a few issues around borders that we've had to intervene on, and a few obviously very, very substantial issues when it comes to the collapse of aviation and the collapse of Virgin that I've been working through as well. So all of those issues have been pretty challenging. We've got federal parliament coming up, and that's been really a difficult decision for me. I'm actually going to stay in Ballarat for this period, the next sitting of parliament. We only found out quite late in the day last Friday that if Victorian MPs were to attend, that they would need to quarantine for 2 weeks and would need to get permission to cross into New South Wales, which was actually on Friday proved very difficult. You saw there's only a number of people from the ACT only just being let in. So it was pretty chaotic. So I had to take the decision. Also, the accommodation I stay in Canberra is refusing to take anyone in quarantine. So it became quite difficult for me to sort of make a decision to not go, but we're working on trying to make sure that there's some way of us coming in by audio link. And you'd think in this day and age, given we've all moved to that should be an easy thing, but apparently not so. So we'll see how that goes. Parliament's due to sit back, I think, on the 24th of August. So hopefully I'll have a presence, but I'll certainly go for the next session. But it potentially means for me, then, as I said, given how busy we are locally, it means for me potentially I might be away for the rest of the year because if we continue to need to quarantine, there's just no possibility of returning in that intervening period because of the sitting pattern. So that's a bit of a challenge for all of us, I think.
Look, thanks for that insight. It's really interesting, and I think from a Ballarat perspective, just understanding how it impacts on our federal member is really important. So thank you for that insight, and I know that you'll be doing your very best in whatever way you can to represent Ballarat, and hopefully that'll be via technology in the short term, but in the longer term, back with the seat in Parliament. So thank you for that. Elizabeth, how are we looking?
So, yes, look, I just put together a little presentation. I worked on it last night, and it was actually sort of quite good fun to go back and look at some of the dates and look really how quickly we did move on this. So I've called this MedTech at light speed because that's certainly what it felt like at the time. And I do think there's a lot more that's possible going forward. So this is just a sort of a quick preview of what happened in the very, very early stages. In 6 weeks, we really started from nothing to a functional ventilator. That's a picture of Sandy, my husband, who's a technical director, with the pieces. He'd gone into work, is in the top left-hand side, picked up a few pieces off the shelf and come home to try and think, well, what can I put together? And 3 months later, we've started a new company, Gekko Medical, and as I've said, their destination is unknown, but I think the potential is good. I won't go through all of these. I've just highlighted really in the bright blue sort of some of the key elements in the time frame, and I suppose it all sort of started on it with a text at 8 p.m. on Sunday night, March the 22nd. Text from Michael saying he wanted to talk to me about something. He thought there was something Gekko could help with, and obviously I spoke to him the next day, and he said, he'd been contacted by Ballarat Health Services, and they were concerned that with the rising COVID, that regional hospitals may not get access to what was a small supply of ventilators, and could we help? And of course, I spoke to my husband, who was in Tasmania at the time, and made a few other calls. And by Wednesday, we'd registered with the state government as a responder, as a company who felt we could do something for the ventilator. By Friday, Sandy had developed his first operating prototype of the GeVentor, just using those bits and pieces out of the Gekko stores. And by the following Wednesday, I made contact with some senior officials in the State Department of Jobs, Precincts and Regions, and by Wednesday we'd put forward a final proposal to the government, working with Michael and the Committee for Ballarat and some other groups. We'll talk about it in a minute, as a collaboration. Certainly by that time, also the Runway Accelerator was printing 3D parts for us to help Sandy put together some components that he needed pretty quickly. On the Thursday, we thought, well, we're not going to get what we're asking for, which was, this is what I was thinking, that we wouldn't get the full $400,000 that we required. So we went out, Michael and I went out and worked with the community. We got a lot of direct contributions, but we also got $60,000 from the Buninyong Community Bank. So we raised $235,000 in a day, and by Friday I'd adjusted our proposal to be a community co-funded proposal for the government. And by the Thursday, Minister Pakula announced the funding to a number of groups, including us. And on the Friday, we had our first cross-disciplinary kick-off team with Mark Yates from Birch and RDV and a TGA consultant, Committee for Ballarat, and a whole bunch of key capability out of Gekko. So it was a pretty quick, light-speed project, and a very exciting and challenging one. I think what we've absolutely loved and what's been so critical has been the regional collaboration that's been established. And, playing a key part in all of this has been Doug Paxton from the anaesthetist group in Ballarat, who's really been very critical in the design process. Obviously, Committee for Ballarat, Runway, Birch, Premier Strategy, and the Buninyong and District Community Bank have all played, and Clark Precision Engineering have all played a really critical role, plus some other sort of external parties such as BAE Systems, 3D Meditech, and Planet Innovation outside Ballarat. So, it really has been a joy in many ways to have that support from all those different groups, and there's no way we would have got where we've got to without that.
Elizabeth, I'm going to jump in really quickly, and it goes back to your first slide. I just want to make sure that all our listeners are acutely aware that essentially we were talking about 5 days from a phone call that you and I had late one Sunday evening to Friday when Sandy had produced a prototype, a working prototype. That is extraordinary, and I don't need a comment because I know you're very humble about that. But to think that 80 years of medical technology around ventilators has been the development of where we now see ICU ventilators, and Sandy had done what he had done in literally 5 days. It's a wonderful and extraordinary effort.
It's an extraordinary effort, and I hope people don't mind when I say that my husband's a genius. Like, he really is he's been recognised in lots of different ways, but this is certainly. He's so skilled at putting together solutions, technology solutions, and, there's a lot more that he's capable of, really. But he really is very, very clever, and then supported by a very, very clever group of people as well. So very fortunate.
Keep going. Thank you.
So then the media coverage really helped, I suppose, to get more and more support from community and also government, so that worked really well. There's a whole group of people outside. You can see here the guy from Runway helping us with the 3D printing, and then more recently we've worked on usability, and that's been working with Doug Paxton, who played such a critical role, an anaesthetist. This is at the Deakin Training Centre in the Ballarat-based hospital, working on the GeVentor and making sure that it's easy to use. We've done a lot of work in preparing the product to be ready for sale, and that takes a lot of work behind the scenes. At the moment, the current status is that we are still waiting on TGA letter of permission to use under the exemption. There's a specific exemption allowed for TGA. Now, normally it would take 2 years to get TGA approval. And I think had the pandemic in Australia really taken off, we would have got TGA approval a lot faster. But of course, because the ventilator no longer became an issue for the Australian medical system, the sort of process for the TGA has been a little bit slower than we'd hoped, but we're still very much in close contact with them and discussing with them every day. That process, they're incredibly, I suppose, amazed by what we've been able to do, because we've had to adjust the design as we've gone along to meet certain specifications that they've wanted. Right now we're preparing to obtain an export certificate, and we've built a controlled environment manufacturing facility so that we can achieve the ISO 13485 that's required for us to achieve the export certificate. And more recently, we've employed a senior quality and regulatory manager to come in and help us finalise all of that and move forward. Our ongoing project objectives, of course, is now we've done all of this, we want to save lives, and we're sort of pretty desperate to get out there. We think there is still interest in global marketplaces outside Australia to use the GeVentor technology. In fact, I was just talking to someone this morning who was quite interested in using it for veterinary practices. So that's another opportunity. But other objectives, we want to strengthen the Gekko innovation brand. We want to promote Ballarat. And of course, out of this process, we're looking to strengthen our quality management systems and our certification. And it gives us the opportunity to diversify into medical devices if that works out. And we certainly think it's possible that Australian governments, both federal and state, will be interested in developing medical device capability in Australia. And we've had a lot of very, very strong support from the state government in this process. And really, I'd like to thank them for their support in getting us to where we are. So we're very sort of excited, I suppose, about the opportunity. It's been a big task. It's been a frustrating task at times now, but we're still full steam ahead and excited about the opportunity.
Elizabeth, thank you. It is a wonderful story, and certainly in terms of timelines, again, it's extraordinary to think that we've been able to achieve that in the time you have. Catherine King, you spend a lot of time around the country. You're a federal minister, a federal member. You see a lot of work that's happening right around the states in regional areas and clearly, particularly Ballarat. I'm interested in what it is about this particular story that gives you some confidence that Ballarat could do more in this R&D space around medical technology and advanced manufacturing, given what we've been able to prove with this particular example.
Well, I think what it absolutely demonstrates is, what we know from all of the sort of academic and real lived experience of what makes successful business or successful industry clusters. We know that where successful industry clusters are, they generally happen naturally. They haven't happened, government might have come in with some assistance or some money to help do that, but they're not the catalyst. It's really something that occurs within a community. And in essence, really it's where communities have identified, what is it that you're good at? What brings wealth in, and then how, what are the gaps in that where you've seen successful clusters. And we use examples across the country, whether it's, if you look at Torquay, where most of our, where Rip Curl, etc. are. You look at over in the west, where there's a particular area of Western Australia where pretty much all of the winter cucumber crops for the country are grown. There've been areas where they say, what is it that we're good at? And the thing that Ballarat has throughout its entire history, and Gekko is such a shining example of this, is in advanced manufacturing and that capability of coming up with new ideas and innovating in that. And I think that's really what we've seen through this, whether it's, in food technology or food production, or whether it's in manufacturing. That's what you've seen, this example really, really highlight and show. So I think that keeps us in good stead, but there are some absolute, as Elizabeth will have noticed, some real challenges. And med technology, we are not the only players in this space. There are a lot of people who are very keen to develop and grow their sectors. So there's a lot of competition and a lot of challenges in doing it as well.
Thanks, Catherine. And I'm going to just highlight that a little bit further and get you to talk that through. Before I move on, I would invite people, we do have a Q&A function down the bottom of your screen. So if you do have any specific questions to Elizabeth, Catherine, or indeed Mark Yates, please put them up into the Q&A and we'll get to them as we go along. Catherine, it is a crowded space. It is a high value space, good yields and good returns if you can get this right. I'm interested in your understanding, and Mark Yates has just joined us, but I'm interested in your understanding of the significance that Ballarat has in terms of two very good hospitals positioned in a town that's just the right size, with 6 universities who have an active presence in the town. And I'm wondering how significant is that, and how important are the relationships and partnerships that we can develop given that context to Ballarat's potential in this area?
think it's an incredible advantage that we have over many other regional centres and metropolitan areas as well, and it's those connections and links. As I said, if you look at successful clusters, it really is those, identifying what brings, what is your unique advantage, what brings wealth into the community, identifying those gaps, looking at collaborations across businesses and small to medium enterprises in particular, looking at collaborations across the university sector, that building those are the things that actually develop successful clusters. And as I said, whether it's in the food technology space or whether it's in medical technology or advanced manufacturing, there are some unique and special advantages that we have here in this community that make those relationships and those linkages easy, but they're things we have to actually work on quite hard.
Thanks, Catherine. And Mark, or Dr. Mark Yates, I'll bring you into the conversation here, and a little introduction up front around what Birch is trying to do is to sort of translate this world-class research into real world-class medical practice. You work every day across this partnership, across the universities and across the hospital sector. I'm interested perhaps in your comments in relation to what Catherine has said, and more specifically in terms of where Elizabeth and Gekko has been at with the ventilator, and just what that might show in terms of our potential here.
Thanks very much, Michael, and thanks, Catherine, and also Elizabeth. I think the thing that the Gekko story taught me, I suppose, was that as small organisations you can be agile, and if you're city focused, you can address some issues. And we were lucky at that moment in time, and it's always about moments in time. We had funding from Regional Development Victoria. We had pulled together quite a significant capability, a research capability. So none of us personally in Birch, and there's a group, we're a small group, there's only about 4 or 5 of us, had specific skill sets in ventilation, but we had Doug Paxton beside us. But what we did have is skills in rapid synthesis, or synthesis of large amounts, or rapid synthesis of large amounts of information. And that's a research skill set around systematic reviews and information synthesis. And the fact that we had that available was interesting, because most of the time we might have had all that resource allocated to specific projects, but at this moment we're new, and so we brought the resource together. We didn't have a specific project that was all allocated to, so we could do something quite quickly. And that, I think, is the advantage of having these sorts of research capabilities in a city that actually is pretty well owned by the city across the universities who make Birch happen, and Regional Development Victoria. I think that the question about the development of med tech is actually a broad question, because there could be med tech which is like GeVentor in many ways. That's actually a completely new piece of tech. I think, in fact, in reality, the way that we will get real traction here is to, as Catherine said, is to go to our natural resources. And our natural resources is this concept that we are the right size city for translational research. In other words, reducing the waste that we see in hospitals. At Ballarat Health Services alone, if we based on the McKeon report, where there's 20% waste in health services, there's $100 million a year in the BHS budget alone that we waste because of duplication, adverse events, and systems errors. And I think technology can help with that. And I think that's where translational research and technology and medtech connect. And I think we have an opportunity to do that.
Great, thanks, Mark. Appreciate those comments. And we've got a couple of questions that are now coming through on the Q&A, and we'll come to those in a moment. Elizabeth, can I go back to you again, and can you just give us an understanding of the major challenges you faced in getting to this point, and particularly how you've been able to overcome them in such a short time frame?
Thanks, Michael. Look, the major challenge for us, well, firstly, I think, just going back to Mark's point, the capability that we found in Ballarat in the most unusual places, and that I had no idea about, including, the work that Mark and Birch did for us in terms of preparing a clinical evaluation for ventilators, was just amazing. And the other one through the hospital with Doug Paxton and his skill set that he provided. If we hadn't been able to access those, I don't think we could have got to where we got to so quickly. So that was really critical. But the difficulty for us, obviously, is the TGA process. It's not something we've done before. It's a very technical process, very specific process. You're dealing with people who want everything absolutely perfect. So, you know, Sandy's got this brilliant brain at designing stuff and getting it to work. But, you know, when it comes to detail, that's not his skill set. You know, that's required a different approach. We've had to learn a whole new way of engaging with them. And we've had to redesign the product as we've gone along to make sure that they are comfortable with that we're meeting the exemption guidelines. The other pieces, I suppose, that we've focused on has been communicating with our stakeholders, whether they be sponsors, government, you know, all the other people that are engaged. If we didn't keep them engaged all the way along, I think the process would have been a lot slower and more difficult. Procurement's been absolutely a challenge, and we've had to design the unit in such a way that we can actually procure the components quickly. And one of the problems with ventilators globally is they can't get the parts. So we had to design the equipment without getting access to traditional ventilator components. And that's what Sandy and the team have done, is so extraordinary. And then I suppose really the last thing is just managing the pace. I mean, it was incredibly full on in those first sort of couple of months. So in some ways, if Australia had continued to have a pandemic problem, it would have been easier because we could have got this through the TGA faster, I think. But of course, that's been a good thing that we've not faced that issue.
And Daniel Sutton, thank you for your question. And I hope that sort of elaborates a little bit for you in terms of some of the barriers, both internally and externally. And if I can say, just on a personal note, Good Friday for most is a pretty quiet day. Good Friday in here at the tech park in Ballarat was a gathering of some really smart minds, and probably 3 hours of the brainstorming session. And Mark was very much a part of that, as was RDV, Regional Development Victoria, and others. So the internal barriers, and I understand the pace. You were driving your staff pretty hard at that stage, Elizabeth, and there weren't too many days off in those early weeks. Mm-hmm. Catherine, can I come back to you, Catherine? And you know the TGA. You've been through the process with them, and you've seen the government oversight in relation to a major authority such as the TGA. What are the learnings you can perhaps give for us that might shine some light or give us some understanding of how we might go about the next steps in the development of the GeVentor particularly, but more broadly in this potential medical tech space?
Well, if I go back to, there's the medical devices, obviously regulated fairly strongly in Australia, and medical devices are categorised by anything from Band-Aids to high-risk implantable stents for heart patients, things like that. And the ventilator's sort of at that higher risk end. It's not quite as high risk as something that's implantable in the body, but it's up there. It's obviously, if it fails, it can cause significant problems. People die. So the regulatory regime that sits around medical devices reflects, it is not. These are not just ordinary, consumer products. These are very important products in clinical, in improving, people's clinical care. So the regulatory regime around it is quite difficult, and medical devices, when they fail, and we've seen some really spectacular failures in this country, from breast implants to metal hips, they fail quite spectacularly, and they do significant damage. So there is a reason that the regulatory regime is quite onerous, but it is also incredibly technically complex. And I think when Elizabeth first rang me, I was pretty wary. I just thought, bloody hell, here's a company that has not ever engaged in this space. And I think, Elizabeth, I probably was pretty warning, and I tried to warn you that, this is really hard, and I'm incredibly impressed that you persevered through that, because it's hard because it has to be, because you've got people's lives in your hands in relation to that. And there are a lot of players that think they can enter into the area but getting that technical expertise, being prepared to adapt, understand and work with the TGA. The more you work with them, and they've not always been open to that, they've got better at that, and this crisis, I think, has allowed them the opportunity to work more closely with device companies. the more that you work with them, you listen to them, the better the outcome actually will be. And I think that would be, the lesson that I've had with any companies that I've had dealings with, whether it's from pharmaceutical companies to medical tech companies, is that really being prepared to work with the TGA, listen to what they have to say. It is frustrating and long, but this process has been incredibly quick compared to what it normally is. It is normally a 2-year process from application. In order to get your product on what's called the Australian Register of Therapeutic Goods, you can't sell it in this country unless it's actually on that register, and that's not something that's easy. And I hope very much that Elizabeth can share some of that frustration along the way, and I cross fingers that all of that is successful.
Thanks, Catherine. I think in any performance environment, and Gekko are working in a performance environment, there's always an element of luck, isn't there? And sometimes achieving results just require that little moment in time that we capture. And Elizabeth, there was a little bit of luck involved with a gentleman who was involved right from the early days, who had some insights into that TGA process. Can you just tell us a little bit about that involvement?
I reckon that's a really great story. Sort of when we first, I suppose, put some news on LinkedIn about the fact that Sandy had developed the ventilator and we were going to try and save lives with it. I got a message through LinkedIn from a young man called Jack Verbeek, who works in regulatory management for a medical device company in Adelaide. And he said, would you like some help? This is like pretty much the first week. Would you like some help with the TGA? And I wrote back and said, yes, I would. And so we had a phone call, a discussion about it, and he was incredibly helpful. I went off and spoke to some companies who sort of helped facilitate the process through the TGA as well. And quite frankly, they didn't sound as clever as Jack did. So we went back to Jack, and he pretty much, as it turns out, he had a partner who lives in Ballarat, and he was coming back to isolate in Ballarat. So he was incredible, and he's helped us right the way through this process in his spare time, over the weekends at night. And I'm very pleased to say that he's now going to join Gekko Medical and Gekko Systems and help us take this company forward and take the Gekko GeVentor forward as well.
It's a great story, and the fact that he happened to be here in Ballarat being quarantined was just the stroke of luck.
Incredible.
Mark, can I come back to you, Mark Yates? Just the importance here in understanding the research, the evidence that sits behind this, the capacity for Gekko to do a pretty thorough literature review was pretty limited for them as a company. What role did you play and Birch play in that, lending that sort of expertise from an evidence-based perspective and really helping the early stages there?
Thanks, Michael, and I certainly want to credit Jack with his skill set, because he was able to frame the construct of a clinical evaluation report through the TGA in a way that made sense to researchers who weren't actually used to doing TGA clinical evaluations. And it took a lot of agility, I guess is probably the best word, of thinking in order to get that right. But in the end, we knew we had certain databases which were going to help us. And so there's a thing called the MAUDE database, which is the FDA's database of everything that can go wrong with a particular product. And there's the TGA's database. And once we had realized that those were our main sources, then it was a matter of laboriously going through each of those databases, looking for the most frequent complications, and knowing that we could evaluate and report back to TGA on where those risks lay and what the GeVentor team had done to modify or clarify those risks for the TGA and the clinical evaluation report. And it was really just taking that body of information and having the research discipline to go through that and actually quantify those risks so that we could respond to them was the key element. And it was done by a couple of very diligent research, both PhD researchers to do that.
And I think, Catherine, this really tells the story, doesn't it, of the significance of the cluster that you were speaking of before, and reaching out to the natural resources, of the natural information, the natural expertise that sits in the town. And Elizabeth has described Sandy as a genius, and clearly he is, but the capacity for Sandy to have done an unbelievably detailed literature review and in and around the sort of work that Mark has just described just simply wasn't possible. So it's that collaboration which is critical here, isn't it?
Look, absolutely. I think that's, as I said, this story really shows that it is that, identifying what is it, what are your natural advantages? And, we are so incredibly lucky to have this huge legacy of, really clever people who make stuff, really clever people. And the fact that, lots of clusters, what happens, it really is, looking at the new growing out of the old or the existing, that really is where you get some, terrific innovations. And I think this is what this story shows that we're capable of, but that it is, that collaboration, identifying what it is that you don't know, who is it that's got the skills and the knowledge, and being prepared to go outside of your own business or your own sector to actually go and ask and get that expertise in. And that's clearly what's happened in this case.
Yeah. Thanks, Catherine. Look, we're getting close to time, but there is another question that's popped up, and Elizabeth, it's the obvious point for us now is what's next in this ambition to help save lives? Where are we at? What's next for you?
Well, we're obviously, there's no requirement or a significant requirement for ventilators in Australia at the moment. So we're looking at export markets as a place for us, and humanitarian opportunities, particularly as a place for us to utilise the GeVentor. To obtain an export certificate, we need to complete essential principles, and it's effectively a self review that we've achieved ISO 13485, and that we've got in place all the essential principles under the TGA requirements. And that's one of the reasons why we've got Jack on board. We believe that we can achieve that. As I said, we've already built a controlled manufacturing environment so that we can reach those goals. And we're also talking with the state government with opportunities as to whereabouts they might be able to apply the ventilator. So we believe we might get some support from them. And we're very much looking towards going into manufacturing the device, both for humanitarian applications globally and for any other requirements that might be needed in Australia.
There's been tragically a great example, I suppose, of where the first response is so critical this week, and that's in Beirut. And if we think about ventilators that most would have an understanding of, they're ICU grade, they're large, they're incredibly expensive, and they sit in the ICU units of major hospitals. I think the significance of this, and this is what we had identified well, right at the very start, was we weren't trying to compete against an ICU grade ventilator, but in some ways this was a first response piece of kit. Could almost be put in a backpack with a car battery and a small bottle of oxygen, and be able to save lives at that very point of tragedy. And again, in Beirut, we've seen that play out this week, and clearly all around the world there's this humanitarian need for first response equipment. So that's a significant part of the story, isn't it?
That's right, Michael, and it does have a number of unique characteristics. There's another ventilator that's been purchased by the government, the Notice ventilator from the Grey Innovation Group, which is a very important device, but it is quite limited in its application. And actually what we've designed at Gekko is quite a sophisticated unit and Doug Paxton's very much helped with this, that can be used, in a lot of different environments, both within an ICU unit and outside. So it actually has quite a lot of unique benefits. And the other thing, I suppose, for Gekko and Gekko Medical is that, we've got at Ballarat Health Services and with people like Doug Paxton, specialists who really have some great ideas about other products and other services and so it doesn't need to necessarily end at the GeVentor.
Catherine, just to come back to you, and it's a question that's come from the floor from Steve Falconer from the Community Bank, and it's a good one, I think, in terms of the leadership that is critical in developing regional capability. So my question, Catherine, is government doing enough to provide that leadership to really energise and to activate the capability that does sit within the regions?
Well, I think, how do I say that? Well, as I said, like, I think, in terms of sort of clusters or innovation, I think, if government tries to say, well, you're going to be the region for this, or you're going to be the region for this, it doesn't work. It's got to come up from the region itself. It's got to be something that is, the natural advantage of a region, that capacity to collaborate, and you come to government to say, we think we can do this. And that's where government can help. And you've seen with the state government, with funds through Regional Development Victoria for this particular project, but also for other innovations, that they're the sorts of things they should be doing, not necessarily coming up with the ideas. They can make suggestions, but really helping facilitate that. At the federal government level, I think, there's not I don't have a real sense that there's a strong regional development policy overall, or that there is a strong sense about, this is how the federal government sees its role in the regions. But there are lots and lots of programs and funding sources. I think Elizabeth's going to talk a little bit about one that's coming out of the Medical Research Future Fund. There's industry funds for clusters. But it's really hard to access. It's really hard to, a lot of it's disconnected, but a lot of it's big dollars. That's really where my office and I come in, trying to, if people have got ideas or things about trying to work out, well, where is it that you go to? How do you facilitate access to some of that funding? And some of it is there, but you've got to work pretty hard to find it out and try and actually get access to it, which is really frustrating, I think, for many people in the regions when you just want to get something done.
The key message, though, Catherine King, really is don't wait for government. Be the ones to
absolutely. Just if you've got an idea and you've got, as I said, it's about thinking about what is it that we are good at. What is bringing wealth into this community? The COVID crisis, to some extent, it's not. And people like, and I know about Sandy. Sandy hasn't had a single thought about, how is this going to make me money? This is about, well, how can I actually help to save lives? And that's, is very, very typical of Sandy and a lot of terrific inventors. But from an economic development point of view, it is really thinking about, what is it that is bringing wealth into this community? What is it that we're good at? Where are the gaps? How do we go about filling those gaps and then developing them further? And whether it is in medtech, and that's where we want to go. And the fact that we've got Gekko, who has got such a, we're incredibly proud of you as a company that you're here in Ballarat, but we've also got some incredibly great manufacturers who have been innovating for a long period of time, whether it's in the car and defence development space, whether it's in food technology. It's how do we support them to look at how we get the new and the expanded to grow out of the old or existing. And I think that's the challenge, and I think that's probably where committee and the universities and the health sector can really play a very strong role as a catalyst.
No, thanks, Catherine. And again, the comment around leadership is that sense of we can't always be just looking for government to be leading here, and that there's local leadership in place. And I think again the GeVentor story is a good example of how a group of local leaders came together to try and bring something about, and that's where that expertise and that resource you have available to you is so critical. So a big call out, big shout out to all our local leaders and continuing to support and develop regional development. Look, for this morning, to the Honourable Catherine King, to Elizabeth Lewis-Gray, and to Dr. Mark Yates, really appreciate your time, your insights. Thank you for coming online with us today. Elizabeth, to you and your team, what a wonderful story this is, what a wonderful story of success, and we wish you all the very best in the next little while. So thank you to those who've come on board to listen. Really appreciate your time this morning and hope that there's been some good insights there for you. So from the Committee for Ballarat, thank you and good day.